Welcome to InfoSource, a presentation of Berkshire Healthcare Systems, a not-for-profit, consumer-centered organization committed to fulfilling the health and residential needs of communities across Massachusetts that we serve. I'm your host, Jenny Sutherland. With us is Sarah Meeker, acute nursing manager, and my friend, Trista Vlach, admissions marketing director, all the way from Charlene Manor, 130 Coleraine Road, Greenfield, Massachusetts, where the jokes are free and the good times keep on rolling, especially if you go to an activity group or are in a wheelchair. So, how is Charlene Manor?
It's really great.
It really is great.
It is. It's really, really great.
Great, great. I'm glad we confirmed that Charlene Manor is great. And we're going to get to the details of that by asking you guys some stuff about Charlene Manor. But first, I want to know a little bit about you guys. Sarah, you're the subacute nursing manager there at Charlene. How long have you been there?
I've been there 5 years.
5 years.
5 years, yep.
That's a good amount of time.
Yep.
And have you always been the subacute nursing manager there?
I was not. I started off as a staff nurse, and then I transitioned to, I was the unit manager for the dementia specialty care unit.
Okay.
And then 2 years ago came down to the subacute unit.
All right. And did you always want to be a nurse?
Always.
Always?
Always.
You never wanted to be like, say, someone might want to be a gumball machine.
No, I actually wanted to be a doctor.
You wanted to be a doctor?
I wanted to be a doctor.
You wanted to be a doctor.
That didn't work out.
So does that work, run in your family, or do you have? No. So it was you.
I'm the only one in the medical field in my family.
All right. Well, I bet your family is grateful for that, especially if something goes down at a barbecue or party. Yeah.
Absolutely.
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 And I know this for a fact that you are in Berkshire Healthcare Systems Stepping Stone program.
I am.
So you are going from your LPN to your RN.
Yes. Yep.
And that's a great opportunity. And how do you feel about that? Are you excited?
I'm wicked excited.
Wicked excited.
Wicked excited. Yep.
And I think that's great. It's one of the things about our organization is that we help people achieve their goals, and they help us achieve ours. So good luck with that. I wish you well. You have a lot of support within the organization, and I hope that we can encourage you to go for your BSNN after that.
That's the goal.
All right. Okay. She's already going for it.
She's ready.
Now I'm going over to you there, young lady.
Yes, yes.
How long have you been at Charlene Manor?
This time around, I have been there for 5 years as the admissions director, but I was a CNA on our rehab unit for about 3 years before that. So 5 years this time so far.
Okay. And does this industry run in your family?
It does.
It does?
It does. Yes, my mother also works for Berkshire Healthcare. She works in our home office department. My sisters are nurses. So yeah, it very much is the chain that we follow.
And if you weren't in the healthcare industry, what would you be doing?
Honestly, I'm not really sure. I have worked in healthcare since I was old enough to work, and I love it so much, and I'm just so grateful to be a part of this company that I honestly don't know what else I would be doing.
And you and I have actually had this conversation before, because we get to spend some time together.
We do.
At events and at times when we're together on projects. And why I started this question is why do you keep doing this? What is it about this industry that keeps you staying in it?
That's definitely a good question. This industry can definitely be a little tricky, but for me, I stay because of the communities that we live in, the people that we can help every day, and for me, I like being able to help someone, anyone, even if it's just one person.
So, and in your role, you get to help a lot. You get to help a lot of folks take advantage of Charlene's services. So we're going to talk about some of those. So we're going to go back over to Sarah, who's eager to talk about what she and her team get done on the subacute unit. Now you have a pretty dynamic Director of Nursing Services, Joanne Lampron, and your administrator, Ashley LeBeau. is phenomenal. And with their support and your team, you offer a wide variety of services. So I think when we talk about a subacute unit, we think about rehab. So let's talk about rehab services first.
So we offer a lot of orthopedic rehab services.
Yeah.
Fractures, joint surgery, knee and hip replacements. And fractures, some of these stays pre-planned, others are from unexpected hospital stays. We have established relationships with our local orthopedics.
Yep.
And are very familiar with each surgeon's individual post-op protocols.
And that's a benefit not only to the person you're taking care of, but also for the doctor, because they know what to expect and you're following their chain of thought on that. And do you see a lot of orthopedic referrals?
We do. For us, we see a lot that are pre-planned.
Okay.
So we certainly get referrals from physicians' offices or from families or the patient themselves.
So a pre-plan means something like, I'm looking possibly in the
Right.
near future to have my knees done. I would call you.
Correct.
And
yes.
what would happen?
So you would call me, and
Yep.
we could set up either a tour if you've never seen our building, or we get you added to our wait list where we keep track of you. We take your surgery date, if you're looking for a private room or a semi-private room, a few things that are important for you for your stay here, so a little more information. And then when it gets closer to your surgery time, we check in with that person to say, yes, we have a bed. Here's what we have waiting for you, and we'll be here when you get here.
And then Sarah and her team take over.
They do.
And a pretty amazing thing that came my way from actually two people in our organization was that, and this is cool, and I'm going to congratulate you before I say it, Sarah, out of all of our affiliates, which there are 15, you're one of 15, you have, for a short-term stay, the lowest rate of stay, which means people are in and take advantage of your services and work with therapies, and then you get them back out in the community at their level that they came in with or above in the shortest amount of time, which is probably the best news anybody can hear if they're looking at staying at a in a subacute unit. They want to get in and get out, yeah?
Yep.
So your length of stay is 14 days. Other people are around 17 to 30, so congratulations.
Yeah, thank you.
What do you attribute that to?
I think because our discharge process starts right at admission.
Sure.
So as soon as the individual is admitted, the clinical team is meeting with them within the next 24 hours. We're kind of me, the director of nursing, the social worker, the rehab department, we're all involved. And we try to figure out what the barriers are going to be right at discharge. And then that's our goal, is to get them back home as soon as possible. So starting that process of discharge from day one, I think is the most important.
Yeah, I mean, I don't think people understand that really a subacute nursing neighborhood's goal is to get people in and out.
Yep.
Right.
And very, very well and above what they expected to be going home at.
Yep.
So congratulate. There's a smile on your face. You should
should be very
smile
proud,
about
very
that.
proud.
You should smile about that. So again, besides orthopedic, which people are most familiar with, what are some of the other things that you and your team handle?
We do a lot of extensive rehab for individuals who have had strokes, new heart attacks, open heart surgery, heart failure, exacerbations of their respiratory problems, exacerbations of their Parkinson's disease, wound care. We do a lot of wound care.
And you guys have a wound care nurse?
Yep, we have a wound care nurse who's in-house, and we also collaborate with a local wound doctor.
Okay.
So he comes in weekly, does rounds with our wound nurse, and then if we have any issues, we have our in-house wound nurse to address. So.
And a wound can be something from coming in with a surgical site that needs
Surgical,
care.
pressure ulcers,
okay.
vascular, diabetic ulcers.
Yeah. the more of the complex care I want to get to in a minute, but there's one other team member that I want to mention that works with you guys pretty closely besides your director of nursing services and your administrator and your rehab and your social workers. And that is, you guys are lucky to have an admissions nurse. And I'm sure that is great customer service for the person coming into your affiliate. So let's talk about that person's role.
So our admission nurse, she works really close with the hospitals, so she gets what we call warm handoffs from the hospitals, and so that helps with the continuity of care once they get to our facility, and then we kind of know what the barriers are going to be right from the get-go. She's there to meet them the minute they come through the door, so she's already starting the admission process. She's working hand in hand with the physicians to verify the orders, and she's got that one-to-one with you, so you can, I understand most are probably nervous, don't know what to expect, but she's there to kind of guide them on what's going to be expected and yeah, keep them comfortable and
No, I mean, I think it's fantastic, and certainly folks who go to Charlene are lucky to have it, and your team's lucky to have it. And I think you just kind of said something, and I just want to reiterate that if people have any control over their need to come and have some time with you, is to take a tour before it, because people don't know what to expect. And it's fantastic you have this person who can kind of help them along a little bit more, but to come and see what your neighborhood looks like. Come and meet people. So, you know, not just looking at surgery and not knowing how that's going to go, but you don't know where you're going to go. So, again, you can tour anytime at Charlene.
Anytime.
They can come and meet you.
Absolutely.
Anytime. Yeah,
Anytime.
it'd be
I'm
nice
there
to
all
meet
day.
They don't let you out during the day. They keep you there.
Yeah.
Okay. Well, that's good to know. So, I want to kind of touch upon some of the more higher level care that you do. I think you do some cardiopulmonary, some IV things.
Yep, we do
we
IVs.
We do IVs.
IV hydration.
Okay.
We can do IV antibiotics. We also have the clinical capabilities of managing inotropic medications, so your milrinones for those with end-stage heart failure.
Sure.
Those either waiting for a heart transplant or just trying to recover from a significant cardiac event.
And I think that's great that Charlene offers that, because, you know, people don't have to go far from, if they live in Turners or Greenfield or even up in some of the hill towns, you know, Buckland, they don't have to go out of the area, go down south or something, and it's good to stay close to home. So it's great that Charlene offers that. That's really, really good.
We even have the capabilities of managing the life vest.
Okay.
Which I think is new to a lot of the area. So
you might want to explain that to the people, because life vest people are like, oh,
so those patients, some patients, they have reduced heart function, and it puts them at it makes them more liable of going into cardiac arrest. Okay. So the life vest it helps them. So if their heart was to trigger some sort of abnormal rhythm, a life-threatening rhythm, the life vest will actually shock them.
Oh.
Yep.
So it's kind of like a built-in safety system.
It's an external.
You're wearing it.
External
defibrillator?
Yes.
Woohoo! That's teamwork. External defibrillator.
Yes.
And Charlene Manor has that.
Yes, we do.
Yep.
All right. What we're going to do is we're going to take a quick break and come back and talk about some more about Charlene Manor. Probably practice saying defibrillator, or maybe not. Anyway, we're going to take a quick break. When we'll be back in a minute after you watch a little bit more about Charlene Manor. Thanks.
Nestled in a beautiful scenic area just minutes from downtown Greenfield, in the heart of Franklin County in western Massachusetts, Charlene Manor Extended Care Facility offers you the best of both worlds. It's a locally run facility, staffed by dedicated healthcare professionals from the Pioneer Valley. And it's backed by the expertise and resources of Berkshire Healthcare, the largest nonprofit long-term care provider in the area. Berkshire Healthcare is committed to fulfilling the health and residential needs of the people in the communities we serve. Charlene Manor is a proud recipient of the American Healthcare Association's National Quality Award. The Quality Awards recognize members' commitment to performance excellence by continuously demonstrating ever-improving value to residents and other customers. The Bronze, Silver, and Gold Awards recognize overall organizational effectiveness and capabilities and champion organizational and personal learning. At Charlene Manor, we pride ourselves on our deep commitment to our community. We offer a broad range of nursing home services, including short-term rehabilitation, skilled nursing, long-term care, hospice, and respite care services. We also provide services that fill specific needs of the community, including an Alzheimer's program that is dedicated to individualized care, maintaining dignity and the highest quality of life for these residents. We proudly offer an elegant, home-like setting that allows our residents the comforts they expect while providing the care they need, including fine dining in our graciously appointed dining room, beautiful outdoor space, ample activities, and private family space. At the heart of it all is a focus on the body, mind, and spirit. Our rehab services include physical, occupational, and speech therapy. Our licensed therapy professionals help restore and maintain the body by focusing on helping our residents improve strength and mobility in order to participate in the activities they most enjoy. These services are provided up to 7 days a week when ordered by a physician. Charlene Manor is more than a place to live. It's a place to enjoy each day to the fullest. Our activities program focuses on the mind and spirit of our residents by offering engaging leisure and recreational activities, arts and crafts, music, discussion groups, exercise sessions, religious services, and cultural community outings and more. Each resident at Charlene Manor receives the highest quality care delivered by our dedicated staff members working as a team. From the nursing staff to our front office personnel, everyone is enthusiastic about the role he or she plays in the lives of the people who entrust us with their care. Our staff is committed to providing compassionate care, using teamwork as their guiding principle. We're dedicated to treating each person with dignity, recognizing their individual needs, goals, and preferences. We create a care plan for each person, focused on helping them achieve the highest level of independence and quality of life. At Charlene Manor Extended Care Facility, we're perfecting the art of superior care. If you or a loved one needs short-term rehab, extra care after a hospital stay, or a nursing supervised full-time living arrangement, we invite you to tour and meet our staff. See firsthand how we enhance the lives of those we serve. To make arrangements or get more information, call 413-774-3724. We look forward to meeting you.
Welcome back to InfoSource, and with me still are my friends from Charlene Manor, Extended Care Facility, 130 Coleraine Road, Greenfield, Massachusetts. In Massachusetts, you are not our only affiliates. There is another affiliate of Berkshire Healthcare Systems, Franklin County Hospice. Do you guys work with those folks? You do?
Yes, we do very closely.
There are some good people there. And how is that relationship?
It's really strong. I think that we both kind of feed off of each other, so we work a lot with them, taking their patients with us on a short-term basis if needed, and they are always there the second we need them, and that continuum of care again, once a person is discharged from our building, we know they're in good hands with Hospice of Franklin County.
And that team there, you know, they've been together a while. They work closely with Charlene even before they were a Berkshire Healthcare System affiliate. So when we joined with them and they came on board with Berkshire, I was very thrilled, because to me that staff felt like part of us anyway. And they do a fantastic job across Franklin County, and do some good work. My mom actually volunteers for them, and she goes into Charlene Manor. So that volunteer program of theirs is very important. And I know not only my mom goes into Charlene, but you guys also have other volunteers from hospice that comes in.
We do, yeah, especially for our dementia residents. That provides a one-on-one care. Sometimes they just like to, sit next to somebody.
Yep, and have them read to and things like that.
Yeah, it's really nice.
So, little plug for our friends at Franklin County Hospice, and
we love
thank
you
them.
guys.
Yeah, we love you guys, and people want to volunteer for them or for Charlene Manor.
Absolutely.
They can just reach out to us. All right. Charlene Manor, besides the subacute neighborhood, we mentioned that you had been the unit manager on the memory care neighborhood. So a little bit about that program.
So we have activities down there 8 hours a day.
Okay.
They have group activities, individualized activities. Each of the patient's care plans is individualized to their needs.
Yep.
We have our own activity director who manages all of that. All of the staff are dementia certified, so they have a lot of extensive training. There's, I think, 9 or 10 of us who have a dementia certification, which certainly helps. We also have our psych team that will come in to help with behaviors if needed. And yeah.
Yeah, no, gone are the days that everybody can say they do dementia care.
Right.
There's new regulations and guidelines, very strict training that's in place.
Yep.
So that Charlene Manor offers that to the community is great.
A support group. We have a dementia support group at least monthly.
Yeah, and
Very
that's
big
for the
yeah.
and that always has been a very big thing there, which is, for the community, the loved ones of the folks going through that. So good. If people are interested in a respite stay, especially as the weather's changing, people are going places and maybe a wedding, do you guys offer respite?
We do, yes. We offer respite on all 3 units, our specialized dementia unit, our long-term care unit, as well as our rehab unit. Our rehab unit does see the majority of our respites, but we are able to take people for any amount of time. We have families that are going on vacation, they drop their loved one off and they're there for a couple weeks. Sometimes it's a couple days, so we can certainly accommodate whatever's needed.
Yeah, I think there's so many services that we all offer, but one that I hope people really understand is what respite care is, and that's not only for the person who needs the care, but it's for the caregiver. And Sarah, you've been going like this the whole time, so you know that it's important. And loved ones sometimes need some time off or need to go have a surgical procedure of their own done. I think we've seen it before where you're taking care of someone on a respite and their loved one is in maybe recouping from some sort of surgery. So it can happen.
Yeah, absolutely.
Okay. So respite is offered there. Where are we on my sheet of questions to ask you? I know, I have to put the glasses on. If folks want to come in and get a tour, what do they do?
They can contact me directly.
Yeah.
Our phone number is 413-774-3724, and I'm at extension 248. Or they can inquire on our website, which is www.charlenemanor.org.
Oh, you do that really well. Wow. Practice that. Maybe we should
I know
have
how to
practiced defibrillator, which, I just busted Sarah on that one. Any upcoming events you want to talk about?
We actually do. We have a few things coming up. We have our hospice butterfly release coming up in August, where we partner with Hospice of Franklin County, and we release butterflies in honor of our loved ones who have passed.
And that you've been done quite a few times.
We have, yeah. This is our 3rd year doing
very
it.
nice.
Yeah, it's very, very nice. We have senior bingo coming up on May 16th, I believe, Thursday, May 16th, and that is open to the community, so anyone can RSVP to senior bingo.
Okay. And National Nursing Home Week is coming up.
It is. That is the week of May 13th, and that is always a lot of fun at Charlene Manor.
Is it now?
We really love Nursing Home Week.
Do you now?
We do.
Well, I'm going to start off by saying it starts, really goes off with Mother's Day that Sunday.
It does.
So we want to salute all the moms out there.
Absolutely.
Whether they're residents, family members, or workers, staff at Charlene Manor, happy Mother's Day. But also recognize that National Nursing Home Week is a celebration of every aspect of nursing homes. Our homes, where we spend the majority of our time, where people live, where people form friendships, fall in love, get really mad at each other, all kinds of stuff. But life is happening. So this is a celebration. So I wish everybody at Charlene Manor happy National Nursing Home Week. I wish all of our affiliates the same thing. Thank you both for coming on and talking about Charlene Manor. It was a pleasure having you. I hope you'll come back again, because there's some more things we can talk about and maybe hear about what else is going on at Charlene. So, all right, thank you. Thank you. I am going to thank everyone for watching and remind you that InfoSource is a presentation of Berkshire Healthcare Systems. Until next time, I wish you good health and good life. Bye-bye.